Support for Radio Friends comes from OsteoStrong. Improvements in bone density, strength, and power can be achieved by weekly 5-minute no-sweat sessions on their 4-spectrum machines. These isometric robotic machines safely emulate high-impact loading on different parts of the skeletal system, which stimulates activity in bone-building cells. Balance and agility can be improved by 2-minute sessions on vibration plates. Every session is supervised by a trained coach. Learn more on Facebook or call to set up a complimentary wellness assessment and session. Good morning and welcome to Radio Friends on this Thursday, April the 29th. We're going to talk about good kidney health today. How does hypertension affect our kidneys? And I want to introduce you to an expert, Dr. Smrita Dorairajan. Good to have you here, Doctor.
It's a pleasure to be here, Paul.
From the VA hospital. And you were telling me that hypertension can have a very negative effect on our kidneys?
Yes. So hypertension is becoming a major global health concern. 1 in every second adult in the U.S. is hypertensive.
1 in every?
2 adult.
You're saying 50% of us?
Yes.
50% of U.S. citizens?
Adult population is hypertensive.
Okay, now what is considered hypertension? The older we get, there's some leeway there.
Yes.
You can have slightly higher blood pressure.
Yes.
As you grow older.
Because there's stiffening of the arteries, and controlling the blood pressure too much when you get older is a risk for falls, and that is why we give a little leeway as you get older. But in the younger population, anything less than 120 on the systolic blood pressure and less than 80 on the diastolic is normal blood pressure.
Okay, so if you have 120 over 80, that's considered normal.
Yes. And anything between 120 to 129 on the top number is classified as pre-hypertension.
And
which
that's
means,
what age group?
This is for every age group.
Okay.
So that means that you have a risk of developing hypertension if you don't make changes to your diet and lifestyle.
Okay, but now I'm over 75. So I take my blood pressure on a regular basis, and it runs around 130, 132 to 80 something. But my doctor had told me that as long as I stay under 150, 90 for my age group,
yes,
that's okay.
Yes, for your age group, that's fine.
So even if I go up to 149 over 89, am I damaging my kidneys at being over 75?
So if it is consistently that number, then we need to think about it. But a random blood pressure just based on one reading of your 149, we wouldn't go ahead and treat you. So it has to be on at least 3 to 4 occasions, which are like 1 to 4 week intervals apart. So,
do you recommend that people check their blood pressure at home?
So that's a very important thing because there are 2 entities. One is called the white coat hypertension.
Right.
And that is where the blood pressure is high when you come to the doctor's office. But at home, your blood pressure is running fine.
Right.
It may be the stress of long hours of travel or just finding a parking space or just seeing a doctor. You're anxious to get a good report.
And that I found that out several years ago with visits to the doctor because I said, well, I'm taking my blood pressure at home. Well, I took the blood pressure at the doctor's office, and it was 150-something over 92 or 93. He said, boy, even for your age, this is high. I said, that's not what it's running at home.
Yes, so that's why it's very important because if we keep on adding medications based on just the office readings, at home it may bottom out your blood pressure and you may have dizziness and you may have falls and head injuries, which is a significant risk in older patients.
So if you're getting high blood pressure readings when you go to the doctor, you need to take your blood pressure at home. And these home units are pretty accurate, aren't they?
Yes. And the other thing, reverse of that is also true, which is called masked hypertension, wherein in the doctor's office your readings are normal, But at home and most of the time, your blood pressure is running high. So about 40% of the population have this kind of hypertension.
Really? I'd never heard of that.
Because that is even riskier because they're not getting any attention or not on any treatment. And this kind of hypertension, which is the masked hypertension, has the highest risk of cardiovascular morbidity and mortality.
So if you're concerned about it, you go to the doctor, you can mask your high blood pressure mentally, and it's going to read lower than it actually should be?
It's just the term given for that, but this situation also happens.
Okay.
And the other thing is called the dipping of blood pressure. So between morning and night, the blood pressure is supposed to drop at night to 10 to 20% less. But in some people, this nocturnal dipping does not happen.
Okay.
They are called the non-dippers, and these people have a very high risk of cardiovascular mortality and morbidity.
Okay.
So when these non-dipping can be picked up only if you check your blood pressures at home, or there's another thing called the continuous ambulatory blood pressure monitoring, where they set you up with a small unit that records your blood pressure during certain intervals in the day and at night.
How often should we, just in general, take our blood pressure?
So I would say twice a day at least.
But every day?
If you're a hypertensive.
Oh, if you're
yes.
hypertension. But if you're falling in that normal category, if you take it once a week or once a month, you're okay?
Yeah, that should suffice.
Okay.
And it's very valuable to take this blood pressure readings to the doctor because that gives them a very good idea of what you're doing at home rather than just a snapshot when you visit the doctor when everybody is under high stress to get a good report.
Right. And that can damage our kidneys.
Yes. So when you have high blood pressure, it causes the thickening of vessels throughout the body because it causes a muscle hypertrophy. So this reduces the blood flow to the organs, especially the kidneys. And then the kidneys lose their filtering capacity, so you retain more salt and water, which leads to more hypertension.
If you get your blood pressure under control, can the kidneys repair themselves?
Yes. So blood pressure under good control is a very good thing.
The kidneys can repair themselves.
Yes.
Right, you are a walking fountain of information. I thank you so much for coming by today.
It's been a pleasure.
If people want more information, where can they go on this?
So VA Hospital.
Just check it out on online.
Yes.
The VA Hospital. Thank you, doctor, so much. One bit of advice, what do you have for people as far as staying hydrated in the summertime? That's so important for our kidneys.
That's very important, yes. So I would say if you don't have any kidney or heart trouble, at least 2 liters of water per day.
2 liters, what is that? How many glasses of water is
8
that?
glasses.
8-ounce glasses of water a day.
Yes.
Okay, and just plain water.
Yes, nothing else.
All right. Thank you, doctor. I appreciate you coming by. And there's a website, www.columbiamode.va.gov. All right? Drop me an email, something you'd like to hear or see, pepperp@missouri.edu. Bye-bye.